is Maddie Nolan Grimes. So I began my apprenticeship in 2010 and then got my license to practice in Alaska in 2013.
I'm Lorna Mazoff, and I began my apprenticeship in 2001 and became licensed in 2005. I've been in Juneau since 2007.
I'm Debbie Gillespie, and I first started attending births in 1997 when I was just a very young girl. And I've been licensed and practicing since 2001. I would say that not everybody wants that kind of experience, but I think when you choose a midwife, you do form a very strong relationship with your clients, and it is that trust that you form that I think is a big part of our good outcomes, because there's trust. We know them and their family, and they know us, and so if there's decisions that need to be made, I think that that it works very well. So in terms of what happens at a prenatal visit, we do the same thing as what you would get at a doctor's office. We check blood pressure and check urine, listen to the baby's heartbeat, make sure the baby's growing. So that is going to be the same, but what's different is the space and time allowed for that process to happen. In a doctor's office, you might not have a long time for that, and usually our visits are at least an hour long, so we get to talk about all the other things that are happening and any questions that they might have.
Culturally in our society, what we see a lot is that dramatized portrayal of childbirth. Give me my epidural, and yelling at the guy, and rah, rah, rah. Like, we love that for some reason, and so much in our, but labor looks so different than that, and especially in a hospital setting, it can look very peaceful. It can look really actually gentle sometimes. There's not that there's not noise, there's not intensity, but it looks different. There's a rhythm to it, and it can be really relaxing in a home environment, in a birth center environment where women feel comfortable, and that's really our goal, is to make people feel safe, make them feel comfortable, so they can have an optimal birth outcome.
Midwifery has grown out of this idea of having this trust and having this relationship with people, so that if babies do have difficulty breathing, or maybe your bleeding is a little heavier than normal and that needs to be managed, you have someone that knows how to do that. And we all have a really great relationship with the physicians in town, and we have the ability to call emergency services if need be, so we can get an ambulance and transport to the hospital if something really was significant. But that's so rare. I mean, having a planned out of hospital birth, we have great outcomes. So.
And also, we attend low risk pregnancies and births. So part of what our job is to make sure that somebody is an appropriate candidate for being out of the hospital, and if they're not, getting them the care that they need so that everyone can be safe.
The birth center generally does around 60 births a year. So,
yeah. In my practice, I'll do anywhere from 8 to 12 a year, roundabout.
Yeah, I would say 10 to 12 a year. I think we both used to practice at the birth center, and we've also trained in other birth center together, so I've attended, I reached 1,000 births about 6 or 7 years ago. So.
I think the biggest concern that people have is safety. Right? I feel like you guys probably run into that, at least at the beginning too, this concern about midwives maybe not being trained well enough to keep them and their babies safe. But what I often kind of explain to people is that midwives have been trained so extensively in what normal pregnancy looks like and what variations of normal look like, that the beginnings of anything being abnormal raises these flags. We all can kind of recognize it's like a ripple effect for a drop falling in the water. So our job is really to either help women fix these complications that are kind of arising, or refer them to someone who can kind of address these issues. So,
really begs the question of why. And so when we look at other nations that are using midwifery, carrying out a possible birth for those low risk populations, we see better outcomes. The doctors are better utilized for the higher risk situations, and their time is maybe used differently, and their skills, whereas, in a nation where they're utilized so much, 90+% it's a lot of work. It's a big workload for physicians. So that's also a big part of our care, I think, is like shifting this mentality of what can our bodies do and why would it be beneficial. So to maybe go at this in a less interventive way. Less is more when you're having a baby, it turns out. So.